Cotard syndrome, or the Walking Dead syndrome, was discovered in 1880 by French neurologist Jules Cotard. He described it during his observation of a 43-year-old patient known as Mademoiselle X, who denied the existence of God, the devil, and her own body. Cotard syndrome makes you believe you are dead. Not metaphorically, literally. Patients say their brain is gone, their blood has dried up, or they don't have internal organs anymore. Some stop eating because they think there is no point. Others ask to be buried. Alice in Wonderland syndrome distorts your perception of size. A doorknob looks enormous. Your own hand seems tiny. Or your whole body suddenly feels like it is shrinking or growing. This is not a dream. It is a real neurological condition. It often affects children and is linked to migraines, epilepsy, or the Epstein-Barr virus. Time can also warp. Seconds feel like hours. Patients call it frightening, but fascinating. The name comes from Lewis Carroll, who likely suffered from it himself. The good news? Episodes usually last only a few minutes. The bad news? You never know when the next one will turn your bedroom into a giant hall or shrink your coffee mug to the size of a thimble. Munchausen syndrome is a rare and dangerous mental disorder in which a person feigns, exaggerates, or artificially induces symptoms of an illness. The primary goal of this behavior is not to gain material benefits, such as sick leave or disability, but rather to gain attention, elicit sympathy, and assume the role of a patient. The story of Gypsy Rose Blanchard is one of the most well-known cases of delegated Munchausen syndrome. In this disorder, the guardian intentionally causes or fakes severe illnesses in the ward, usually a child, in order to receive care, attention, and financial assistance. The details of this case unfolded as follows. Feigned illness. Gypsy's mother, Dee Dee Blanchard, spent years convincing her daughter and others that she suffered from leukemia, muscular dystrophy, asthma, epilepsy, and mental retardation. Abuse. The healthy young woman was subjected to unnecessary medications, tube feeding, and forced to use a wheelchair for years. Dermatozole delusion, also known as Ekbom syndrome, is a mental disorder in which a person is convinced that they are infected with parasites, insects, worms, mites, etc., although there is no objective evidence to support this belief. Dermatozole delusion can be either primary, occurring spontaneously as a monothematic disorder, or secondary, which occurs in the context of other mental, neurological, or somatic disorders. Some possible causes include schizophrenia, anxiety disorders, obsessive-compulsive disorder and phobias, endogenous depression, organic lesions of the nervous system, atrophic brain diseases, dementia, strokes, etc., intoxication with psychostimulants, cocaine, amphetamine, methamphetamine, caffeine, etc., somatic diseases, diabetes mellitus, chronic renal failure, hepatitis, hypertension, etc. In some cases, the development of delusion can provoke stressful situations, previously suffered from parasitic diseases, scabies, pediculosis. Apotemophilia, body integrity identity disorder, BIID, is an extremely rare disorder in which a person experiences an irresistible urge to amputate one or more healthy limbs as they perceive them as foreign or alien parts of the body. This condition is also known as body integrity identity disorder. Some characteristics. Origin. The exact cause of the disorder is unknown. There is a hypothesis about the neurological inability of the brain's function of mapping the internal body, located in the right parietal lobe, to include the affected limb in the understanding of the physical shape of the body. There are also studies that point to a connection with a decrease in the amount of gray matter in the right superior parietal lobule. Symptoms. A persistent and irresistible desire to amputate a healthy limb or become paralyzed, which can lead to significant distress. People with BIID may experience discomfort with having a limb, considering it to be unnecessary or superfluous.